What do you know about herpes? Is it a common cold sore or something more severe? These questions often arise when we first encounter the term herpes. Many of us associate it with occasional cold sores or fever blisters. But it's essential to know that herpes is much more than just that. It's a viral disease caused by the herpes simplex virus, or HSV for short, and it comes in different forms. Some people might think it's a rare condition, but here's a surprising fact. A significant portion of the global population carries some form of the herpes virus. Misunderstanding and misinformation about herpes are widespread, leading to unnecessary fear and stigma. It's not a scarlet letter or a life sentence. It's a common condition that millions of people live with every day. Understanding herpes begins with understanding the virus that causes it. So let's dive deeper and unravel the complexities of this ubiquitous yet misunderstood virus. The herpes virus, scientifically known as herpes simplex virus, comes in two types, HSV1 and HSV2. Now don't let the scientific jargon intimidate you. It's actually quite straightforward. HSV1, or herpes simplex virus type 1, is primarily known for causing cold sores or fever blisters around the mouth area. These are often experienced as small fluid-filled blisters on or around your lips. You may feel a tingling sensation, discomfort, or even a burning feeling before the blisters appear. It's important to note that HSV1 can also cause genital herpes, but it's less common. On the other hand, we have HSV2, or herpes simplex virus type 2, which is usually responsible for genital herpes. This can cause sores in the genital or anal area and sometimes even on the thighs or buttocks. These sores may be accompanied by flu-like symptoms such as fever and swollen glands. It's essential to understand that HSV2 can also cause oral herpes, but again, this is less typical. Both types of the herpes virus are highly contagious and can be transmitted through direct contact with the sores. But it's also possible to contract the virus even when no visible sores are present, a phenomenon known as asymptomatic shedding. While some people may show clear signs of infection, others may not even realize they have it. This is because the virus can sometimes remain dormant in the body for extended periods with no apparent symptoms. It's a sneaky little virus indeed. So how do these viruses affect different areas of the body? Well, HSV1 primarily affects the mouth and lips, while HSV2 typically affects the genital area. However, both viruses can affect either area, depending on the site of infection. While these viruses may sound intimidating, it is important to remember that they are fairly common and manageable with the right knowledge and treatment. Being diagnosed with herpes can seem daunting, but it's not the end of the world. It's a condition that millions of people around the world live with every day, and while it does require some adjustment, it's far from insurmountable. Let's talk about the impact of herpes on a person's daily life. For starters, there's the physical aspect. Herpes is characterized by periodic outbreaks of painful sores, typically around the mouth or genital area. These outbreaks can be unpredictable, sometimes triggered by factors like stress, illness, or hormonal changes. It's important to remember that everyone's experience with herpes is different. Some people may have frequent outbreaks, while others may go years without a single one. Now, these outbreaks can be managed. Antiviral medications can help reduce the frequency and severity of outbreaks, and over-the-counter treatments can ease discomfort. It's also crucial to maintain a healthy lifestyle. Regular exercise, a balanced diet, and plenty of sleep can all help boost your immune system and keep outbreaks at bay. Herpes also has a social aspect. There's a lot of stigma attached to it, largely due to misinformation. It's essential to educate yourself and others about the condition. Remember, having herpes does not define you or your worth. When it comes to intimate relationships, honesty and open communication are key. It might seem scary to disclose your status to a potential partner, but it's an important step in preventing transmission. Using protection during sexual activity can dramatically reduce the risk, but it's not foolproof. It's also worth noting that herpes can be transmitted even when there are no visible sores. So regular checkups and medication are important. So, what does living with herpes look like? It involves managing outbreaks, maintaining a healthy lifestyle, and navigating social and intimate relationships with honesty and understanding. It means taking care of your physical and mental health, and not being defined by a condition. Living with herpes is about managing the condition, not letting it manage you. It's about taking control of your health, being kind to yourself, and remembering that you're more than your diagnosis. You're a person, first and foremost, and herpes is just one part of your story. Herpes is a chronic condition, which means it can have long-term effects on the body. Now let's delve into what these potential long-term effects could be. Firstly, recurrent outbreaks. Herpes is a tenacious virus that can lie dormant in your body for years, only to rear its ugly head when you least expect it. These outbreaks can occur several times a year, especially under periods of stress or when your immune system is compromised. Each outbreak can bring about the same uncomfortable symptoms as the original infection, including sores, fever, and body aches. Secondly, there's the increased risk of other sexually transmitted diseases. Herpes can cause sores and breaks in the skin, which can be gateways for other infections. This means that having herpes can make you more susceptible to diseases such as HIV. And then there are potential complications in pregnancy. If a woman has an active herpes outbreak during childbirth, there's a risk that the virus could be passed on to the baby, causing neonatal herpes, a serious condition that can lead to long-term neurological damage or even death. However, it's important to note that this is rare, and there are steps that can be taken to prevent transmission to the baby. But it's not all doom and gloom. Many people with herpes lead perfectly normal and healthy lives. The key is managing the condition effectively. This includes recognizing the symptoms of an outbreak, taking prescribed antiviral medication, and maintaining a strong immune system through a healthy lifestyle. It's also crucial to keep the lines of communication open with healthcare providers. Regular checkups are essential to ensure that the condition is being managed well and to adapt the treatment plan if necessary. Remember, herpes is a common condition, and there's no reason to feel ashamed or isolated if you have it. With the right care and management, the long-term effects can be minimized. The key to managing these long-term effects is early detection, proper treatment, and regular checkups. Herpes might not have a cure yet, but it can be managed, and its transmission can be prevented. When it comes to managing herpes, there are a few key options that you should be aware of. The most common form of treatment is antiviral medication. These drugs work by reducing the severity and frequency of outbreaks, giving your body a better chance to fight off the virus. They come in different forms: pills, creams, and even injections. It's important to remember that these medications don't eliminate the virus entirely, but they can make living with herpes more manageable. Some people find that certain lifestyle changes can also help manage symptoms. This might include maintaining a healthy diet, getting regular exercise, and ensuring you get enough sleep. Stress management is another crucial aspect, as stress can often trigger outbreaks. Now let's talk about prevention. Herpes is most commonly transmitted through direct contact with a herpes sore or lesion, or through contact with the saliva or genital secretions of an infected person. This means that one of the most effective ways to prevent transmission is through practicing safe sex. This includes using condoms or dental dams during sexual activity and avoiding sexual contact altogether when an outbreak is occurring. It's also worth noting that herpes can be transmitted even when there are no visible symptoms, a phenomenon known as asymptomatic shedding. For this reason, regular testing and open communication with partners is essential. There are also steps you can take to prevent spreading the virus to other parts of your own body. Avoid touching any sores you have, and if you do, wash your hands immediately. It's also a good idea to keep the infected area clean and dry to help reduce the risk of secondary infections. Remember, an informed individual is an empowered individual. Understanding herpes is the first step towards managing it effectively. Let's recap what we've learned about herpes. We've delved into the nature of the herpes virus, understanding its workings and how it affects the human body. We've shed light on the experience of living with herpes, acknowledging the challenges but also the resilience and adaptability it can inspire. We've explored the long-term effects of the virus, emphasizing that while it can have serious repercussions, it is also manageable with the right care and treatment. And importantly, we've highlighted the strategies for treatment and prevention, from antiviral medications to lifestyle changes, reinforcing the notion that herpes doesn't have to define one's life. In sum, knowledge empowers us. It helps us to respond effectively to herpes, promoting early detection and treatment. It also allows us to destigmatize the condition, fostering empathy and understanding. Remember, understanding herpes leads to healthier, happier lives, and that's a goal we can all get behind.